The NHS has just unveiled a groundbreaking weapon in the fight against cancer, a development that could change the lives of millions of people across the UK and beyond. For decades, cancer has been one of the most daunting challenges in medicine, affecting families, communities, and healthcare systems worldwide. Now, a new chapter is beginning. The innovation, a 5-minute injection dubbed the super jab that could revolutionize how cancer is treated. Unlike traditional therapies that often require hours of intravenous infusions, this new approach condenses the process into a matter of minutes. It's a simple injection, but its impact could be profound. This super jab delivers a powerful immunotherapy drug directly into the bloodstream, harnessing the body's own immune system to fight cancer cells more efficiently. It marks a significant departure from the old, time-consuming intravenous drips that have been the standard for so long. Patients no longer have to spend hours hooked up to machines, waiting for their treatment to finish. For years, cancer treatment has meant lengthy hospital visits, uncomfortable procedures, and grueling side effects that can leave patients feeling drained and isolated. The emotional and physical toll of these treatments is immense, not just for patients, but for their loved ones as well. The new injection promises to change all that. By dramatically reducing treatment time, it allows patients to spend less time in hospital and more time living their lives. It also means fewer disruptions to work, family, and daily routines, making cancer care more accessible and less daunting. Imagine receiving your entire treatment in the time it takes to grab a cup of coffee or read a few pages of your favorite book. That's the potential impact of this breakthrough. A treatment so quick and convenient it could fit into a lunch break or a short visit to the clinic. For many, this could mean the difference between feeling like a patient and feeling like themselves again. The super jab isn't just limited to one type of cancer. It has the potential to treat a wide range of cancers, offering new hope to patients who previously faced limited options or lengthy, exhausting treatments. Doctors and researchers are optimistic that this could open doors to even more advanced therapies in the future. This is not just a victory for science, but a victory for humanity. It's a testament to the power of innovation, compassion, and the relentless pursuit of better care. For patients, families, and healthcare workers everywhere, the 5-minute super jab represents hope, progress, and a brighter future in the fight against cancer. To truly appreciate the impact of the revolutionary 5-minute super jab, it's important to first understand what cancer patients have traditionally endured during their treatment journeys. For decades, the standard approach to treating cancers like bowel cancer has involved lengthy chemotherapy sessions. These treatments often require patients to spend hours in hospital chairs, connected to slow-dripping IV infusions. Imagine for a moment a patient recently diagnosed with bowel cancer. They must return to the hospital again and again, sometimes weekly, for multiple rounds of chemotherapy. Each session can last anywhere from 2 to 6 hours, depending on the medication and the patient's response. The process is not only physically exhausting, but also emotionally taxing, as patients sit in sterile rooms, watching the slow drip of medicine and feeling the weight of uncertainty. These extended sessions often leave patients feeling drained both during and after treatment. Side effects like nausea, fatigue, and discomfort are common, making it difficult for patients to maintain their normal routines or spend quality time with loved ones. The emotional toll can be just as significant as the physical, with many patients experiencing anxiety and stress before each appointment. Now, imagine a different scenario. The introduction of the super jab marks a dramatic shift in cancer care. Instead of being tethered to an IV for hours, patients can now receive their life-saving medication through a simple injection that takes just 5 minutes. This means less time spent in the hospital and more time living life outside its walls. The benefits are profound. Patients experience far less discomfort and disruption to their daily lives. Healthcare professionals, too, are able to care for more patients in less time, reducing waiting lists and easing the burden on busy hospital wards. The super jab not only streamlines the treatment process, but also restores a sense of normalcy and hope for those facing cancer. The thought of spending countless hours attached to an IV can be overwhelming and even frightening for many. The super jab removes much of that anxiety, offering a faster, more dignified alternative. With this innovation, patients can receive their treatment and quickly return to their families, their work, and the activities that bring them joy. It's a powerful step forward in making cancer care more compassionate and less intrusive. Ultimately, the super jab is more than just a medical breakthrough. It's a testament to the NHS's unwavering commitment to patient-centered care, ensuring that hope and healing are delivered not just in minutes, but with genuine compassion and respect for every individual's journey. The super jab expands the reach of cutting-edge medicine to more patients. It has the potential to treat up to 15 types of cancer, including head and neck, lung, breast, and prostate cancers. For young people facing rising skin cancer rates, this could be a game changer, less invasive, more convenient. By harnessing the immune system, the super jab shifts cancer treatment toward a more targeted, personalized approach. It's about giving patients the best possible chance at a long and healthy life. The time-saving nature of the super jab has profound implications for both patients and the NHS. For patients, it means less time at the hospital and more time for what matters most. From the NHS perspective, the super jab allows hospitals to treat more patients and reduce waiting lists. As a subcutaneous injection, it can be administered by a wider range of healthcare professionals, freeing up specialists for complex cases. This streamlined approach could revolutionize cancer care, making it more accessible and patient-centered. It's about working smarter to deliver world-class healthcare. At the heart of the super jab is a powerful class of drugs, immunotherapies. Unlike chemotherapy, immunotherapy helps the immune system recognize and destroy cancer cells. The drug used is nivolumab, a PD-1 inhibitor. Cancer cells exploit PD-1 to hide from the immune system. Nivolumab blocks this, letting the immune system attack cancer. This targeted approach means fewer side effects compared to traditional chemotherapy. It's precision medicine in action. The excitement around the super jab is palpable among doctors and patients alike. In hospitals and clinics across the country, you can feel a renewed sense of hope and optimism in the air. Medical professionals who have dedicated their lives to fighting cancer are now witnessing a breakthrough that many thought was years away. Patients, some of whom have been on long and difficult treatment journeys, are now looking forward to a future that feels brighter and more secure. The atmosphere is electric, filled with anticipation and gratitude for what this new treatment could mean. Dr. Sarah Jones, a leading oncologist, calls it a momentous day for cancer care. Standing before a crowd of reporters and fellow doctors, she explains how this innovation is not just another step forward, but a leap. "We are witnessing a turning point," she says, "where advanced science meets real-world impact, and lives are being changed for the better." Her words resonate deeply with everyone in the room as they realize the magnitude of this achievement. This new injection advances our ability to treat a wide range of cancers quickly and effectively. Unlike traditional treatments that can be time-consuming and exhausting, the super jab is administered in just minutes with minimal side effects. Patients echo this enthusiasm, sharing stories of how their lives have been transformed. Nurses and doctors are also relieved, as the process is simpler and less taxing for everyone involved. John Smith, treated for lung cancer, says, "The difference is night and day. Before, I would spend hours in the hospital feeling drained and anxious. Now I'm in and out so quickly I hardly have time to worry." His story is just one of many, as patients from all walks of life describe how the super jab has given them back precious time and energy. With the injection, it's over in minutes, and I can get back to my life. For many, this means returning to work, spending more time with loved ones, or simply enjoying the everyday moments that matter most. The relief is visible on their faces as they leave the hospital, no longer burdened by lengthy treatments. These stories are powerful testaments to the treatment's potential. Support groups are now filled with hope, as survivors and current patients share their experiences and encourage one another. Doctors and nurses, too, are inspired by the positive changes they see every day, reinforcing their commitment to providing the best care possible. The super jab offers hope and a brighter outlook for countless patients and families. For many, it represents a second chance, a new beginning after months or even years of uncertainty. Families are able to look forward to the future together, celebrating milestones and making new memories. It's a game changer in the cancer journey. The medical community is united in celebration, recognizing that this breakthrough will shape the future of cancer care for generations to come. As doctors and patients come together, they mark the start of a new chapter, one filled with hope, healing, and the promise of better days ahead. The super jab arrives alongside another breakthrough, an AI-assisted blood test that can detect over 50 types of cancer early. This technology analyzes DNA traces from cancer cells, offering a non-invasive, highly accurate method for early detection. Early diagnosis means better chances of successful treatment and survival. Together, AI-powered detection and rapid treatment create a powerful 1-2 punch against cancer. Innovation and collaboration are key in this multifaceted fight. Despite these advances, cancer rates are rising among younger generations. Skin and bowel cancers are increasingly common in young adults, driven by lifestyle and environmental factors. Prevention, like sun protection and regular screenings, is more important than ever. The super jab's accessibility encourages younger people to seek timely treatment. It's time to empower all ages to take control of their health. The super jab is the latest in a series of advancements driving up cancer survival rates. Thanks to research and innovation, more people are surviving cancer and living longer. The NHS is committed to further progress, with trials exploring new combinations and applications for the super jab. This is the beginning of a hopeful new chapter in cancer care. The 5-minute super jab marks a pivotal moment in cancer treatment history. It's the result of years of research, dedication, and the unwavering spirit of patients and professionals. This breakthrough shows the power of innovation and collaboration. The super jab restores hope, empowers patients, and transforms the cancer journey. As we celebrate these advancements, we must keep pushing boundaries and never give up hope.